people around you. So you need some good mentors. And I had some heads of department and other reasonably high up people who said, this makes total sense and we can help you do that. So really important to get that support around you, even though you can find those people may not step up and actually publicly say it, but they'll give you enough support in the background. And also find out who are the influencers in your organisation. And I was quite good at that, finding out who were the people who would say yes to things, even if it was just to let you try something for a little while. So a big, slow-moving organisation, it can be quite hard to make change happen. But you can say, what if we did a trial of this for 6 weeks? People will happily take on a thing like that.
Yeah, that's a great suggestion.
That was really beautiful. There was one time I was trying to stagger the admission times into the theatre so the children weren't all waiting for 5 or 6 hours. And theatre were resistant to an overall change, but they gave me a 6-week trial and nobody ever came back to me and said, stop that trial.
Yeah.
So we've been going 15 years on that trial and it's fantastic.
Yeah, I can see
so
it.
So there are ways and means, and also try and be maintaining your joy in what you're doing and in your work by connecting with other people who have that sort of joy.
Yeah, I so agree with that. And I did a whole episode, actually, a few episodes back, with someone about marketing and joyful productivity. So it was about, and it is so much of the way that we make decisions to continue doing stuff that feels challenging or hard is finding the joy in it and keep coming back to that. How can we do something in a way that's joyful? That's less, that pushes up against things less. So your suggestion of, finding those people of influence within an organisation that you do connect well with, that might be more likely to, I suppose, give you that permission card.
A little bit of permission. They can help you get round the blockers. Because every organisation has got people who, for one reason or another, like to say, no, that can't be done here, it can't be done that way. And if you can just go around that sometimes without causing too much fuss, that's good. And I also found you could really celebrate small wins. Yeah. So you don't have to win the whole thing, it's not really about that, but you'll have small things that just come off and then you go, oh, that's really good. We've made another step. So at one stage, one of the parents said to me, we wait for hours when we come to clinics and we know everybody's busy, but, you could treat the families with respect and give us a pager like the doctors and nurses have got and we'll go to the park with our child.
Brilliant.
It was beautiful. And then he said, well, I'll go to the State Emergency Service and I'll get you a box of pages. And it was so exciting. It was a small thing, but we then had these pages that were handed out.
It's quite a big thing, I think,
He made us a brass plaque to put up on the wall that said, if you think you'll be waiting for a while, ask the nurses for a parent pager.
Brilliant. That's great. And I think it is about celebrating, making sure that we stop and celebrate, because I think that in life generally we don't stop and savour that feeling of completion, not necessarily completion to the end, but completion of something or celebration of something, and really recognise it and acknowledge it before we're moving on. It's like we get so busy that, what's the next thing? What's the next thing? Without actually savouring that feeling. And by doing that, it gives us that extra boost of energy to go to the next thing.
Well, I think you're right. So I would find as I was going through this journey that my energy would dip and I think this is just too hard. I don't need any more battles or people saying no, because what I'm trying to do is actually very sensible. And then you would have one of these things come off and you go, right, okay, we're still moving ahead with this and it's all going to be fine.
Yeah.
So one of the other things the parents had said to me early on was that the environment of hospitals and healthcare is quite challenging and stressful, particularly when you've got a sick child and you're all feeling vulnerable. And what about some music? So music's always been a really big part of my life at home and with my own kids, etc. And so I started bringing musicians and composers into the hospital. And that was one of those other very energising things. It wasn't stressing anybody or, because it was an artistic, creative thing, it was seen as a very positive thing. And these composers and Australian musicians have now composed us 18 albums of the most beautiful music that is in children's hospitals, aged care, palliative care, out in the community. And because this music came from this very special place where you're in a stressful, hard situation, what's the music that's going to help and not raise people's anxiety by being more of a cacophony in the environment?
Yep.
This music is really tailored to keep people calm and help them feel relaxed. And it certainly helped me too in my work. If I was having tough times, I'd think, well, we've got some composers coming in next week. It's all going to get better.
How amazing. So, you've gone from just making some small changes with just sitting down with a few parents and asking them about things that don't feel, that raise their anxiety levels or cause them stress in the environment, changing a few of the things like the procedures or the timetabling for coming into the procedures, giving pages so that they can go out and come back in. And then all of a sudden you're transforming healthcare through the arts.
It seemed like a logical next step. And in fact, it was only a small step to begin with. I was after some music for my own operating theatre to lead kids and families in and then have this lovely music in the background. But I made a couple of CDs and then people kept saying, oh, can I burn that? And we ended up burning about 50 of them. Then we thought, oh, there's something in this. And we started to publicise it and it just went absolutely crazy.
Amazing. It's amazing. There are so many people out there who have brilliant ideas and they just stay at the idea phase. And I hope it's inspirational for people that may be listening today that have an idea, and hearing Catherine share some of her story about how she's just had that idea and just sort of started with a small action, maybe not even had a grandiose plan around it or any vision, but just let it unfold organically. And when the call was there, she was able to listen to it and run with it. So flow with it and not go, well, no, that's just something extra to do. And I've got enough to do on my plate and I've got 5 kids and I've got a husband and I work, a number of days treating patients and, and all these things. But instead, not even letting that hold you back, but instead really going, well, yeah, this can be done. That's just the next natural step to do.
And a lot of it, I've just felt really curious about what's going to happen if we do look into this a bit more. And I know that I don't have expertise across all these areas, but I'm really good at the connections and bringing people in. So when the parents said, let's have music, I thought, well, I play a bit of piano, but I don't really know how this would work. But I know some professional musicians. Let's ask them.
Brilliant.
So it's about the expertise and bringing lots of expertise to whatever the problem is.
Well, it's about the connection, and it's about what I've run events for a couple of years for, and that's the collective wisdom. So I think that there really is something to say about collective wisdom, not only just in like you've just shared, bringing the musicians in an area that you couldn't necessarily fulfill, so you've found someone that can, but also just in the team. So even just as simple as the wisdom that the parents were able to provide.
Yes, that's exactly right. And you sort of build off each bit of collective wisdom until you end up with a much better whole situation. So when you talk about the team, yes, there's the patients and the families, the absolute centre of the team, and we're trying to work with each family to make sure the journey's as good as possible. Then we've brought in the musicians. Then we've actually started to think about the operating team, so the doctors and the nurses and the technicians and all the people involved. Our team is very special because we value each person's expertise wherever it is. Brilliant. If you came into our operating theatre, you would not know who's the boss in that room. It's not a hierarchical situation. It's We are all working together for the best care of that patient and family.
And that's how it really should be. Unfortunately,
it's not always.
It's not always, but that's really how it should be. And I strongly, I'm a real believer of the non-hierarchical system, and whether it be, working with a whole lot of women in business, and someone is just at an idea phase and someone has got a thriving business, I truly believe that each of them have something to offer each other. And it's not like one is of greater importance. They just might have had, the timing might have been there for them to be explored earlier, or they might just have age on their side to actually have the years to explore it before, or just circumstances are different. But it doesn't mean that everybody's got wisdom that they can share and bring and collaborate together for the best outcomes for everybody.
Exactly. So thinking about the team and how the teams function sent me on another journey. In 2010, I had a Churchill Fellowship to look at patient-centred care and patient safety. And that was 8 to 10 weeks over in the US and the UK. When I got over there, it really hit home, talking to patient safety experts, that the next big challenge for keeping our patients safe was how staff treat each other.
Yeah.
And it was an area I'd been thinking about, obviously, from my team functioning and also seeing other teams that weren't working so well. But to realise that the whole patient and family-centred care movement would fall over if staff didn't look after each other and if organisations didn't look after staff. I suddenly thought, in a way, we've been barking up the wrong tree. We've got to sort out some of the staff things before we can have the capacity and the energy and the passion to look after the patients and families to our absolute best ability.
So something I've heard you say before, which sort of falls under that, is that we've got an emergency in healthcare culture.
Exactly. I came home from overseas thinking, oh my goodness, we've got to do something about this pretty fast, and didn't really know how we might make this bigger shift, because it's an unspoken thing in healthcare that we don't always treat each other well. Nurses don't treat each other well. Nurses and doctors have problems. The administrators and the doctors. It's really a difficult cultural environment.
And I think that that's the case, not just in that environment, but in lots of organisations, from the corporate organisations to the healthcare to the educational system to political systems.
Exactly.
A lot of them have this problem. And I think that, if you're online and you follow a lot of stuff to do with culture in companies, there is starting to be a shift where there is a bit of a more cultural awareness and a necessity to be changing some of the culture for better outcomes. So that's a real positive.
But see, in healthcare, what concerned me was where things are going wrong in healthcare all the time, and a lot of the culture can be behind it.
Totally.
Poor communication, poor respect between staff, not listening to each other, not listening to patients and families. Things go wrong. So whereas the airlines many, many years ago looked at the culture in the cockpit because they know that poor culture in the cockpit brings down a 747, we on the daily basis in healthcare have things going wrong for patients and families.
Terrible.
One injury here, one death there. It's much harder to quantify than the airlines. So that's why this emergency has been just bubbling along there.
Totally see why that's an emergency. So, just going into that a little bit further. So it's obvious to see why that is an emergency. There's a death here and problems going on here and wrong medications here and, things that can actually go wrong.
Yep.
And it's not just going wrong that are affecting the bottom line budget for like some companies. It's actually going wrong and affecting people's lives.
Correct.
So I can see why you say that there's an emergency in the healthcare culture. But what are the consequences of this stressful healthcare culture?
Well, as you said, there's the medical errors and there's the things going wrong, but there's also the impact on the people working in healthcare. So